Well, May is Stroke Survivor Month, so we wanted to look at ways you can be proactive before you suffer from one. And joining us here today is Dr. Ryan Smith from St. Luke's. First of all, thank you so much for joining us here on the News at 4.
Thanks for having me.
Yeah, so what are some of the signs or symptoms, if you will, or signs for people who might be experiencing a stroke?
Yeah, it's really important to understand that stroke symptoms are first sudden in nature, happens rapidly. Can range from things like numbness or weakness, speech changes.
And then if you suspect that someone is having a stroke, what should you do?
Very important question. So the first thing the person should do or their family is call 911. We don't recommend that a loved one take their loved one to the ER. We want an ambulance to take them. That's most in part because they know which place is closest and which place can offer the most highly up-to-date care.
Is there a certain demographic or age range of someone who is more prone to having a stroke?
Absolutely. This tends to happen more in people who are over the age of 55 or who may have some other vascular risk factors such as diabetes, high blood pressure, high cholesterol, or smoking.
You know, real quick, you hear things like if you smell burnt toast or some nuances like that. Is there any truth to that?
I wouldn't think smelling burnt toast would necessarily indicate a stroke. That would be atypical.
Got it. And then if you're, having a stroke, can put a person at risk of having another one. What are some things that people can do to kind of stay healthy so that they're not so prone?
Yeah, thanks for that. So I would say the most important thing a person could do is to have regular care with their primary care physician, having their blood pressure checked regularly, their blood sugar checks, and just having a physician go over their health history to make sure that they're preventing everything that they can.
And how often should someone do that, to do those regular checkups?
At least once a year for someone over the age of 50.
Does that change if you've had a stroke previously?
Absolutely. So if someone's had a stroke previously, it's going to put them at a higher risk for stroke in the future. And that may need to involve another healthcare provider, such as a neurologist.
Good to know. What can the range of impacts be from a stroke, and how can people live a quality life after having a stroke? Because I think that's a concern, right? If you have a stroke, how do you move on?
Yeah, that's a great question. So in medicine, we have a lot of different providers that can provide different aspects of care for someone that's had a stroke. Everything ranging from medications to injection, physical therapy, speech therapy.
Talk about the resources out there for folks.
Yeah, so there's several resources in the Boise area. The American Stroke Association has a local support group, as does St. Luke's Health System have a local support group, and anyone can find that information online.
All right. Anything else you'd like our viewers to know who might be watching right now?
Yeah, I'd just like to reemphasize the need that if anyone has a sudden onset change in their neurologic status, to call 911.
Okay, Dr. Ryan Smith with St. Luke's, thank you so much for joining us here on the News at 4. We'll be right back.
Thanks for having me.